State of Public Health Emergency, formal nang idineklara ni Pangulong Rodrigo Duterte dahil sa local transmission ng COVID-19. Si Melo Lesmora sa sentro ng balita.
Sa bisa ng Proclamation No. 922, opisyal nang idineklara ni Pangulong Rodrigo Duterte ang State of Public Health Emergency sa buong Pilipinas dahil sa banta ng Coronavirus Disease 2019. Sa ilalim ng kautusan, iba yung pagtutulungan ang ipatutupad ng mga government agencies at local government units para lalo pang mapaigting ang mga hakbang laban sa COVID-19. Nakasaad din dito na maaaring humingi ng tulong ang Department of Health sa Philippine National Police at iba pang law enforcement agencies para sa pagtugon sa sakit. Sa isinagawang laging handa press briefing sa Malacanang, personal ding ipinaliwanag ni DOH Secretary Francisco Duque III ang kahulugan ng naturang proklamasyon.
The objectives are clear. There are about 6 for which this declaration is being made. Number 1 is to facilitate access of sufficient funding, especially for the local government units who need such funding for preparatory activities, if not for actual response. Number 2 is for purposes of easing the procurement process, not necessarily mean to avoid procurement altogether, but just to streamline the procurement process so as not to consume an inordinate amount of time to get the materials on board to support us in our COVID-19 response. And then number 3 is the mandatory reporting. It is crucial that under this declaration, all health facilities, including private hospitals, and obviously the public hospitals, the local government unit hospitals as well, must continue to report to the DOH for their intensified surveillance of influenza-like illness and also of the severe acute respiratory illness. This will guide the DOH to have a more focused isolation, detection, and then contact tracing. And so this is certainly crucial. And then the fourth objective is really to do mandatory quarantine. Once justified, once the situation calls for this, the DOH order for quarantine must be followed in earnest by everyone.
Kasabay naman ng State of Public Health Emergency, umiiral din sa Pilipinas ang Alert Level 4 o Code Red Sub-Level 1 dahil sa COVID-19. Sa paliwanag ng DOH, ganito ang pagkakasunod-sunod. Kapag Alert Level 1 o Code White, ibig sabihin may pinaghihinalaan o kumpirmadong kaso na ng sakit sa labas ng bansa. Kapag Alert Level 2 naman o Code Blue, may naitala ng kahit isang imported case sa loob ng Pilipinas. At susunod naman dito ang Alert Level 3 o Deklarasyon ng Public Health Emergency of International Concern ng World Health Organization. Kapag naman Alert Level 4 na o ang umiiral ngayong Code Red Sub-Level 1, ibig sabihin may naitala ng local transmission ng sakit. Itataas naman ito sa Sub-Level 2 kung may ebidensya na ng community transmission at patuloy na ang pagkalat ng sakit nang higit pa sa kayang tugunan ng gobyerno. Pagtitiyak naman ng Presidential Communications Operations Office sa publiko, patuloy ang magiging mahigpit na pagtutok ng pamahalaan hanggang tuluyang mapigilan ang pagkalat ng COVID-19.
Rest assured that we will give a strong and united message in coordination with IATF members and ensure to double, if not multiple, our interventions for the needed information of the public. Vigilance, preparation, and solidarity are what we need, both in the private and public sectors. All hands on deck, and we will not lower our defenses.
Melo Lesmora para sa Bayan.